So I will be talking on topic Giant Sebaceous cell carcinoma of lid, metastasis masquerading as a diabetic foot ulcer. So sebaceous cell carcinoma, as we all know, is the most common tumor in India. It's great masquerader and it looks like a chelizion. Common sites are metastases are lymph node and liver. Early diagnosis help in the treatment and better survival rate. So our case was a 90-year-old male who was known diabetic for 2 years with a history of irregular treatment on diabetes. His chief complaint was left eye upper lid swelling, sudden increase in the left eye swelling for past 3 months, which was associated with diminution of vision in the left eye due to unable opening of the left eye. It was associated with mucopollulant discharge, swelling which bled on touch, and pain in the left upper eyelid. Past history, the left upper eyelid swelling was noticed 8 months ago, which was increasing in size, painless in nature, and for past 3 months showed a sudden increase in size. The patient also had a non-healing toe ulcer over the right toe. It was small in size initially, which gradually increased in size and was not responding to local antibiotic treatment. And it was diagnosed as a diabetic foot by the local doctor. General examination showed pallor, clubbing, and large left-sided periauricular lymph node, level 1 to cervical lymphadenopathy, an oval-shaped ulcer with serous discharge of 4.5 into 5 into 1 centimeter was present over the right big toe. Ocular examination showed a swelling covering the left eyelid extending 0.5 centimeter below the left eyebrow. Loss of eyelashes, distortion of eyelid margin, hyperpigmentation was seen over the left eyelid surface. On palpation, hard induration fixed mass of above dimension was noted. These are the pictures of the lesions. Here you can also see the toe. So a blood investigation showed that the patient had an anemia, but the fasting and postprandial blood glucose level were normal. He was also HbS-Ag positive. FNAC from periauricular and cervical lymph node was taken, which showed a round to polygonal tumor cell with multivacuolated cytoplasm with nuclear pleomorphism suggestive of metastasis of sebaceous cell carcinoma in periauricular and lymph node. On contrast in CT, there was ulcerative proliferative soft tissue in the orbit involving the lid and extension into the eyeball and left lacrimal gland. Lungs and parenchyma and the right iliac bone also showed metastasis. On histopathological examination, the left eye showed a nest of round to oval bacillite tumor cell showing peripheral palisade with abundant pale vacuolated cytoplasm. The right toe ulcer FNAC showed a non-healing right toe ulcer with stratified squamous epithelium with hyperkeratosis with subepithelium showing nest of tumor cell infiltrated into nearby stroma suggestive of metastasis of sebaceous cell carcinoma. So a diagnosis of left eye sebaceous cell carcinoma with TNM staging of T4N1 M1 with type 2 diabetes mellitus and HbS-Ag positive was made. Treatment, the patient was given a radiotherapy with external beam radiotherapy of 30 grays in 10 divided fraction. A chemotherapy with carboplatin and paclitaxel with 4-5 cycle was given 21 days apart. On follow-up, the plain bleeding and size of left eye swelling and toe ulcer were reduced and the patient was symptomatically better. So to conclude, that it is eminent for the clinician from various departments to be aware of the masquerading ability of sebaceous cell carcinoma of the eyelid and its potential for distant metastasis to rear side with previous clinical presentation, which often leads to misdiagnosis. Poor evaluation and multi-department conclusion with timely invasive investigation procedure for potential distant sites. In all of the literature study, none of them have reported a metastasis of ocular sebaceous cell carcinoma to the extremities like the toe. So it should be taken as one of the clinical features. These are my references. Thank you.
Yeah, it was a good presentation of a single case study, and I think the outcome was quite good to that extent. Yeah, good.